I'm going to be talking about infant massage with a purpose of increasing bowel movements, decreasing their bloat, and improving abdominal mobility, specifically to the infant. The setup for this exercise involves the environment, so ideally it would be in a place where your infant is going to feel the most calm and relaxed. You want to focus on lots of surface contact with your hands when you're doing the massage to your infant, and the timing for it is really dependent on the infant's tolerance, but ideally up to 10 to 15 minutes would be great just to allow the mechanic of the massage to really start working and show its ability to help. I'm going to review 3 different techniques that you can use on your infant: a light effleurage technique, a deep colonic technique, and hip circles. So the first technique is light effleurage, and that's just a term used in the massage world that basically means light touch, slow, very superficial, just over the skin. And so how you move your hands is the direction that you want the material inside to move. So if we want the stool to move in the direction of the bowels, we're going to follow a question mark shape. So down the left side of the infant's belly, up the right side, and across the top. As you follow that movement, what's happening is you're creating a little bit of friction with the skin, which gently pulls on the lymphatic system. And once that lymphatic system is stimulated, it really stimulates the blood flow in that same area. So a little bit technical, but just know that even though this type of massage isn't really reaching deep into where the bowels are, there still is a ton of benefit just because of the amount of blood flow that this can create in the specific area. And also the additional benefit that the infant is going to be more relaxed and calm. And so any tension in the gut or bowels that the infant may have had might dissipate. And once that releases, they're able to have better digestion. Once you go through the effleurage part of the massage, you can move on to the deeper part, the deeper technique, and really this is as deep as your infant is tolerating. So in an ideal world, they would be completely relaxed through their abdominal muscles so that as you massage deeper, you can stimulate the bowels with your pressure and your massage. This deeper technique that addresses the bowels with the pressure has an additional benefit of stimulating a process called peristalsis. I'll explain that more in detail elsewhere, but just know that this process of peristalsis is a contraction, a squeezing and relaxation of the intestine. This process should happen normally on its own, and what it does is it helps move stool through the intestines really efficiently. In a child or infant that is symptomatic or constipated, bloated, some kind of tension in the belly, this process might slow down or stop completely. So the benefit that this massage addresses that and helps to encourage the process of peristalsis is a great benefit of this type of massage. So to complete this type of technique, this deeper technique for massage for an infant, it's going to be the same process of using your hands, lots of surface area contact, but you're going to use, I tend to use my middle 3 fingers of my left hand and my thumb of my right hand. That's just what I find most comfortable. And you're going to go through the muscle as deep as you can until you feel resistance. If the infant is resisting and there's a lot of contraction of the abdominal muscles, you're not going to be able to push through those with your massage, and that would not be an appropriate time to really push your massage through those muscles. They really do need to be relaxed. And then you're just going to do tiny little circles with your fingers or thumb wherever you're guiding your pressure, and you're going to follow the route of the large intestine. So if you're looking at the infant, you're going to go up your left side, so their right side of their belly, across the top by the rib rib cage, the bottom of the rib cage, and then down the left side of the abdomen, and then underneath the belly button. It makes a shape similar to a question mark, and you're just going to follow that pattern. In this video, I'm not particularly sticking to that question mark repeatedly. I'm just kind of finding areas of restriction and staying there. Either is appropriate, whatever you feel most comfortable with. Hip circles is the last technique I'm going to go over for infant massage. And what this does is it creates pressure in the abdomen as you kind of squish the lower abdomen with the infant's legs and then release and pull down. And there's kind of an increase and release of pressure, which might help stool move through the intestines better. It's going to be the same direction as the massage technique that we just completed, and you're going to do slow, gentle circles. I'm going to go a little faster with the hip circles than what I would recommend just for demonstration purposes, but the direction and the amount of range of motion that you're looking for is appropriate in this video. Just think about going slightly slower when you do it with your infant. As you complete the hip circles, you want to be mindful of how your infant is tolerating this exercise. So if you feel a lot of resistance, activation of their abdominal muscles or their leg muscles, they're pushing against you, then that's an indicator that they're not tolerating this activity, and it might be more beneficial to either try something else or save this for later, because in this moment they're not tolerating it, and so it's not going to give you the benefits that you're looking for, and it actually may create more challenges.